My name is Ahmadshaker Amarkhil. I live in Afghanistan, Kabul province, and that I am a general dentist. That I work in a clinic now from uh, 3 years experience. That I am working as a dentist, and I work into ortho and general dentist do problems that I did studied my dentistry in very hard situation, but I'm glad that all hard situations that passed, and today I have a work, but also I need to get my improve myself, get my because of lockdown everywhere and every people uh, can't work and they are jobless now, and it's very hard for that they need to work and earn some money for their family, make food, and the situation is very hard for every people, especially for countries that they are poor,
Question
like
number one, okay?
Afghanistan.
Why did you
Uh,
become a dentist? Why did you choose dentistry?
because of that, in first I'm loving or like dentistry, and when I was small, I'm always come to dentist and tell to dentist I want to become doctor. And in this case, my father, my family, very well support me, and financial support, and also in other cases that family support them, boys and girls. That because of that, I choose dentistry because I like it, and I want to serve from this way to my people and to patients, to uh, people that they need to help.
So, is any of your family dentist? I know you have two brothers, two sisters. Anybody's dentist? Are you the only dentist in the family?
So I'm the only one.
Interesting. Tell us about your family. Tell me about your brothers, your sisters, your father. We want to learn more about your family. Tell us about your family.
Uh, as I will tell, okay, I have two brothers, two sisters, and my parents. And that I have my big brother, 27 years old, that he studied in college pharmacy 2 years, but after that, he started computer science, and but unfortunately, better that today's he is jobless, and he is and don't have work, and he is at home, and I am a dentist and 25 years old, and my other small brother, and 21 years old to 20 years old. He is in the first years of hydrogeology engineering in Kabul University, and my brother has also married, that he have a daughter 4 years old, and also his wife that studied English literature, language literature in college. Also, my sister that he is 22 years old, that she is also in college now and study English literature as also, and my other daughter, 70 years old, she is in the last year of high school, uh, and we have a good family, and also my father, uh, 53 years old, 53 years old, yeah, and he's get his bachelor in criminal literature, criminal investigation, and also he's now in Kabul. He's a policeman, and my mother unfortunately don't have work. He is working at home.
Your family is highly educated. Everybody, had a lot of education. So you mentioned your older brother, he studied computer science, and right now
Yeah.
he is unable to find a job. Can you tell us why? What is the situation in Afghanistan? What is the situation in Kabul? With all these people with so much education, why are they having trouble finding a job?
As you know better, our political situation is, you know, you heard about this in news, and we have very bad situation. Also, for that, the job chances here to find very, very difficult. Also, here's you can get money to someone. After that, you can find job like that. Problems we have here, and I hope one day all these problems solve, and criminals when they graduate from universities or get their have them mastery or other fields, they can find a job very easily like other country. And yeah, I accept that we have this problem in Afghanistan. Better poor uh, uh, countries, we have this problem, unfortunately.
Is it difficult for dentists to find a job? Is it difficult for dentists to make a living?
Uh, in that, we can say difficult, but not like others, because dentists can open very easily just clinic after pass national exam. Like uh, in India, we have Medical Council of India. Also, we have in Afghanistan Medical Council of Afghanistan. When we pass this national exam, after that, we easily can get our license from uh, Ministry of Health, and after that, we can easily open a clinic and do our works.
So when you're studying dentistry in Afghanistan, how much does it cost to study dentistry? And how many years of education does it take to become a dentist?
It's different cost in different universities, but in which university that I studied, it's a private university that in high level of one of the best university of Afghanistan, also in one of the best university in Kabul by the name of Ghalib University, and 50,000 or 10,000 amount I must pay for 5 months, one semester, 5 months, and in 1 month I must pay 10,000 Afghani, and we have most different different cost in different university, and every one university get money from the situation from the facility they make for their students different.
So how many years is dentistry? 5 years, 4 years?
Here, dentistry is also different. In some university 5 year, in some university 6 year, but also I say that in university that I studied and finished dentistry, it was 5 year, but they want to learn this to 6 year, because in my view 6 years better, that don't press or pressure comes up pressure on student, he, and he without pressure they can continue their lessons usually 6 years.
So how much money do you think approximately in US dollars is it to study dentistry for 5 years or 6 years? How much is it in US dollars approximately?
Uh, uh, in one semester I paid um, 60 100 $600 paid for university and finish my dentistry. But I told before that it's different in different university. Cost is different.
So, how is practicing dentistry in Afghanistan? Is it difficult?
Because of it's a little difficult because we don't have any special facilities here. When one hospital we have for tech specialty that it not have any enough what I can say that yeah, we have some problems here. We have some problems here in practicing dentistry and also in other medical field. We have problems. Yeah.
What is the biggest problem? What is the biggest problem for you?
The biggest problems for me, first of all, better financial problems, also facilities like machinery, like time, like when we want to study somewhere, we must pay in practice or in university or every year we want to study something, but we must pay uh, uh, money. But because of that, most of people here have financial problems and clinics and in hospitals when they have also financial problems and they can't earn that facilities we have in other countries like in United States or Germany or in other countries. Also, we have a lack of specialists here, the perfect specialists. So we have more. We working here general dentists. We have a lack of specialists here, especially in uh, Kabul is better than other provinces of Afghanistan, but in other provinces, maybe in one province, maybe one or two specialists we have in dentistry or in other field, but more of doctors that work here, they are gender.
So I know you do endos. You've told me already, and I know you also place implants. So can you tell me how did I saw that you place BioHorizon implants, and I saw your bone graft material, very impressive. So tell me a little bit about who trained you how to place implants.
We have here head of our clinic by the name of Dr. Wali Hamdad. He's my co-worker and my head here. He trained me in all cases because he is specialist. He has a specialty in dental surgery, and he do, and I assist him. Um,
Just like everywhere else. That's how we learn. How about endo? Who trained you how to do endo?
yeah, also many practice of in dentistry I learned here in this clinic. This clinic is my dentistry home. I learn everything in practice here. Also, I get a short fellowship also by help of two specialists. Yeah, one my head here, uh, Dr. Wali, and other Dr. Yusuf Sultani. They are specialists and they train me here. Also, I get a fellowship from them in Endo.
Congratulations. That's awesome. So how has COVID-19, how has that virus, how has it affected Afghanistan? How has it affected the practice of dentistry? I know you told me you're closed. Am I correct?
Yeah. As you know better that this virus is spread to all country all over the world, and affected all over the world, and especially we can say like the United States that more have case of dies and infected patients. Also in other countries like Italy, Britannia, France, in other countries. Uh, and when we say in Afghanistan in the poor country, as you know, that more fixed people, more fixed um, doctor staff, dentistry, and every fields because we haven't enough PPE kits, masks, gloves, glasses, or everything that we need to protect ourselves from this virus. Because of lack of these things, we can't work goodly or save ourselves. Yeah, as I told you that 90% or 95% or 80% of doctors close their clinics, their office, and 50% others that they work, they are the high risk of infection of this virus because they haven't any enough protection